In today's video, we're going to be going over exactly how to get on the right drug plan, Medicare supplement plan, or Medicare Advantage plan for your specific situation. Now, guys, you're going to want to first go to a site called Medicare.gov. Medicare.gov is one of my favorite assets that you can have when you're enrolling into Medicare because it's going to show you all the different plans in your area and how they cover your situation specifically. So let's get right in here. So it's going to be a site called Medicare.gov. When you go on here, it's going to say, welcome to Medicare, get started with Medicare. And they're going to have some type of person on the front page here. But if we scroll down just a little bit here, you can see we've got some different options. So the first one is you can log in or create an account. Now I will tell you, if you do not have your Medicare number yet off of your Medicare card, which you probably don't if you're not 3 months out from turning 65, if you don't have that, you cannot create an account right now. But you can still go and do your research. So if we go to the second option here that says find health and drug plans, you can click find plans now and actually look at the plans without creating an account. Now, what are the benefits of creating an account? You can keep track of all your medications in one place inside of Medicare.gov. So that way it's easier to review all the changes when October through December rolls around and all these plans change. But for now, let's just go in as a guest and look at some of the different ways that you can find plans. So click find plans now. And then you're going to want to type in your zip code. So I'm going to type in my home zip code here, 65804. But you feel free, if you're following along and doing this while watching this video, you can actually put your zip code in. But then you're going to want to click continue. And then you're going to want to look and see, hey, am I wanting to look at Medicare supplement or Medigap plans? Am I wanting to look at Medicare Advantage plans? Or do I just want to look at Medicare drug plans, separate prescription drug plans? So you can do any of that right here. So let's first look at Medicare drug plans. So we're going to click Medicare drug plans and then find plans now. Then it's going to ask you, hey, do you have Medicaid? Do you have any type of extra help? Do you have any of these programs? If you're not sure, just click I don't get any help from these programs because you can find out later and then change it. But then we're going to click continue. Then it's going to ask if you want to see your specific drug costs when you compare all the plans. I would highly suggest putting yes, stopping, and inputting all your medications in here, because then it's going to show all the plans and how they cover your specific medications. So let's type in a few here. Let's type in lisinopril. Then you'll click add drug, and then you're going to click you're going to put in the dosage, quantity, how many do you take per day, and then frequency. How often do you pick it up? Once a month, once every 3 months. Then you're going to click done or add to drug list. Then you're going to click another one. Let's put in metformin. Should be down here, metformin. There we go. Add drug. I'm just going to assume everything's right here. Now let's put in one more here. Let's put in a insulin. So let's put in Humalog. And then it's going to ask on some of them, do you want to put the generic in or do you want to keep the name brand? For any insulins, I would suggest keeping the name brand because it's going to apply to the $35 cap that they have with insulins. So we're going to put keep name brand. That all looks good. Add to my drug list. Now, let's just say that these are the only 3 medications that you're taking. So we're going to scroll down, click done adding drugs, and then it's going to ask us to put in our pharmacy. So if you have a pharmacy, you can just put in one, or if you want to see all the different ones and see if there's any ways to save money at certain ones, you can put in several. So we're just going to put in CVS, Walmart, and Walgreens, just 3 main ones here. Then we're going to go down and click continue to view plans. And then it's going to show us all of the drug plans available to us. So you can see there's 14 drug plans in this specific area that we're looking at. And this is how they cover them. So we're going to look, I always like to look at 2 things. One, the monthly premium. I'm not as concerned about the monthly premium as concerned I am as the total drug and premium cost for the whole rest of the year of 2025. So this number here is going to be the monthly premium, so $20.70 times however many months are left in the year, plus you actually physically going to the pharmacy and how much you have to pay picking up your medications. So I definitely care about that one more, because if we go down, you can eventually get to where the monthly premium's less, but your out-of-pocket is more because it costs more picking them up at the pharmacy. So this would overall be the cheapest one for those three medications. And you can click plan details and you can actually kind of see a breakdown of what the cost is. So $20.70 a month. And then when you pick up those three medications for the whole year, it's $245. So if we click drug coverage, it's going to bring us down to here and it's going to show us a breakdown. So both, if you can see, if I go to Walmart or Walgreens, it's cheaper than going to CVS because they're both preferred. But you can see the metformin and lisinopril are $0 the whole year, but the Humalog is $245. So that's what you're paying for when you actually pick it up. So you can see it's $35 a month at Walgreens and Walmart. So that's how you're going to get on the cheapest drug plan for you in your area. Now let's go back. Let's look at Medicare Advantage plans real quick, just because it's easier to switch. If you ever want to look at Medicare Advantage plans, you can put it in at the start instead of the drug plans, or you can just click View Available Medicare Advantage Plans, and it'll bring us to it. So now you can see there's 34 different Medicare Advantage plans in this zip code that we put in. You can see for the most part, a lot of them are going to pull up, well, just one is going to pull up $0 for all the medications. But you can see scrolling down here, Humana's got them for $210 for the rest of the year. Another Essence has them for $245. United Healthcare has them for $245. But this is how you can make sure, one, that you get on really good drug coverage, even if you go with a Medicare Advantage plan. But also you can click in here. So like AARP's Medicare Advantage plan, plan details. You can look at all the different insights on the plan. $2,900 max out of pocket. Scroll down here, you can actually see the copays on the Medicare Advantage plan. So doctor visit, I got to pay a $0 copay. Specialist, $25 copay. You kind of get the point. You can see all about your plan that you're looking at, and it makes it a lot easier to see kind of like, is it a good plan? Is it not? What are my out-of-pocket expenses? What does it look like if I actually need to use the plan? So that's how you look at the Medicare Advantage plans. Pretty straightforward. Now let's go back real quick and let's look at Medicare supplement plans. So we're gonna go back to the home page here, go down just like we did before, find plans now. We'll just keep the same zip code. And then instead of putting the first two, we're gonna put Medigap policies. So click Medigap policy, find plans now, and now it's gonna bring up the different Medicare supplements. So type in your age, 65, male, do you use tobacco? No. And then you can even put if you have a roommate discount, spouse discount. Sometimes they give you a discount if you're living with someone over age 50. But we're gonna update this here. And now it's gonna show us a range. So Medigap Plan A costs $117 up to $340 a month for a 65-year-old male in the zip code that we put in. Now let's scroll down and look at the most popular one is Medicare Supplement Plan G. So you can see it's $174 up to $353 a month. So if you want to look at them, you can just click View Policies. And then it's actually going to give you a breakdown of all the different costs with each one. Now remember, all Medigap policies are the same. So every Plan G with every carrier is going to be the exact same coverage. So you really want to focus on this price here. And then overall the stability of the company. But yeah, you can see all the different ones that you have available to you. Guys, if you have any questions, leave them in the comment section below. And if you're confused about Medicare and you want some one-on-one help, we offer one-on-one consultations for absolutely free. We do not charge anything whatsoever. So if that's something you want to take advantage of, the link is in the description down below and in the comment section where you can book a one-on-one call with me. We'll go over all your medications, your pharmacies, your doctors, and all the different plans in your area and make sure you make a great decision. Guys, thank you so much for watching, and I'll see you in the next video.